Crying can do it, can trigger an asthma attack. That's right. Laughing can do it. How many of you have had an asthma attack triggered by laughing really hardly? Even being really, really angry. Yeah, these emotional states, crying, laughing, anger, can trigger asthma attacks. But these aren't the only sort of unusual or symptoms that may seem atypical in terms of triggers for asthma attacks. I got more for you. Guys, I'm Dr. Jen. It is good to see you. We're talking about unusual and usual common triggers for asthma attacks. All right, so that's that. Also, let's talk about going into the cold air. Now, a lot of my asthma sufferers in my practice, my patients who are asthma sufferers, this is something that many of them have had. They go into cold air and they immediately sort of feel a chest tightness. They get those asthma attack symptoms. The asthma starts coming on with cold air. How many of you have had asthma attack triggers, or rather asthma attacks due to cold air, your asthma coming on? Also, exercising. This is a relatively common one. We call this exercise-induced asthma. You're fine, you're good until you start exercising, jogging, running, whatever you do. And that causes chest tightness, the asthma symptoms, etc. Again, that tends to be something that's relatively common. But also something that I see a lot in the office as a family practitioner is infections. When some of my patients, when they get a cold, they get a flu, they get bronchitis or whatever, that can absolutely trigger an asthma flare-up, okay? They start getting wheezing and everything. And I'm going to tell you what some of the most common asthma symptoms are. We'll go through that. But having an underlying infection can absolutely trigger an asthma attack. Tobacco smoke can do it. It's just another reason not to smoke, is because it's not only not great for your lungs, it's not great for your lungs and can lead you to lots of lung conditions, okay? But tobacco smoke can definitely trigger asthma flare-ups. Also, chemical exposures. Have you ever had this where, and I've had this with some patients where they're cleaning, maybe their bathroom or their house, they're in an enclosed space, they have not ventilated the space well enough, they're using harsh chemicals, and the smell literally can trigger an asthma attack. Now that also can go for occupational exposures as well. Working in a factory, working in a certain environment, and you're exposed to chemical smells, that can absolutely do it. And then allergens, very, very common, right? Allergens, it could be a ton of things. Dust mites, mold, pets, your dog, your cat, other people's dogs, other people's cats, pollen, you name it. Allergens can trigger asthma attacks for a lot of people. What did I not get to? Air pollution, right? Air pollution is a big deal for a lot of reasons, but it also happens that during times of bad air pollution, people's asthma really starts acting up, okay? And then also certain medications can trigger asthma attacks. Now remember, some of the more common symptoms of asthma attacks are, and asthma in general, asthma symptoms are coughing. But what's interesting about asthma is that you can get a cough, especially at night, during exercises we talked about, and laughing, which we talked about. But the nighttime is something that's, you got to remember that. Also trouble breathing, shortness of breath, but also another hallmark symptom of asthma is wheezing. What is wheezing? It's like a whistling sound or a squeaky sound that you can sort of feel in your lungs when you breathe, especially when you exhale, that is when you breathe out. Guys, let me know if you have asthma, if you have asthma attacks, what your triggers are, write them in the comments. Also, let me know if you're on medications for asthma. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on Facebook, on YouTube. Please subscribe to my channel, click the little bell for updates. Guys, I'm on Instagram, TikTok, etc. at Dr. Jen Caudle. And please go to my website, www.drjencaudle.com.